Okay, today we're going to be doing the emerald peel. It is an AHA peel. I have talked to my client about contraindications, and her concerns today was the fact that she's having some breakouts and hyperpigmentation. So this is a very good peel for her. Her skin is also a little bit sensitive, so the mandelic acid peel is great for sensitive skin. So I've looked through the protocols, and I have set up the cleansing, the moisturizer, and the Vaseline to include the mucous membranes, as well as my massage medium and my mask. So I'm going to start the cleansing routine. The first thing I'm going to do, even if your client does not have makeup on, we are still going to cleanse the eye and lip thoroughly. So because we want to make sure that when we do a chemical peel, that we totally degrease the skin. That means degreasing the skin means we don't want any dirt, debris, or makeup on the skin. So I'm going to go ahead and apply my eye pads to my eyes, client's eyes, and I'm going to press gently so that the eye makeup remover can remove the makeup, dirt, and debris. And I'm going to go ahead and support the lip, and I'm going to do big movement, corner of the mouth. Now when we do the cleansing, we're going to be using a gel cleanser to thoroughly degrease and defat the skin prior to the peel. So using a daily gentle cleanser is an excellent pre-treatment and pre-cleanser to be able to really degrease and defat the skin correctly. We're going to leave this peel on 1 to 3 minutes. So I'm going to start with my first cleanse, and I'm going to go ahead and use So the gel cleanser is going to help remove makeup, dirt, and debris and give the client a thorough cleansing prior to the peel. This is a very gentle cleanser, and it's an excellent cleanser for this client to be using at home. We do not want to use a cleanser that has oil in it because we do not want to put oil on the skin. So that was my first cleanse. Then I'm going to go ahead and do my second cleanse. I'm using aesthetic wipes. They are disposable, and to really remove the cleanser, and then we're going to go ahead and do our second cleanse. I'm going to use the Daily Gentle Cleanser for my second cleanse as well. The reason why we are cleansing the décolleté is because we do a massage of the décolleté while the mask is on. So that during that time, we have enough time to massage the décolleté and hands. All right, we're going to go ahead and remove the cleanser. And then we'll go to our skin analysis. So I'm going to be looking at her skin underneath the mag lamp. She has told me about her concerns with hyperpigmentation, as well as the breakouts that she's been having and sensitivities. So this is a great mask for her to be using. And we are using gloves from the beginning to the end of the skin treatment. You may change your gloves during the treatment if you feel you need to. So I'm going to analyze the skin. Anytime that you feel that the hair gets a little messy, you can go ahead and stop what we're doing and clean up the area. So I'm going to go ahead and put my iPads on. I'm going to use a 4x4 aesthetic wipe that I'm going to twist to create a butterfly. We're going to apply those to the eyes. I'm going to let the client know that I'm going to analyze her skin. So I'm going to look, touch, and feel the skin. And I'm looking through my magnifying lamp. I like to check behind the ears, pinch the skin for elasticity, for dehydration. So my client has a combination skin, and she has good elasticity. She is a little dehydrated. And I do notice the sensitivities around the nose area and on the forehead and on the cheeks, as well as the hyperpigmentation. So this is a very good peel for her to have today, and it's going to look great on her skin. And I'm going to also give her some home care advice. I'm going to let her know that she needs to stay out of the sun. She needs to not exfoliate her skin for 7 days, no exercise for 24 hours, no heat on the face, no hot water in the showers for 48 hours, no waxing the area for a week to 10 days. And this peel can be done every 2 weeks. So I'm not going to take the clarifying toner. You can use clarifying toner or you can use alcohol. And I'm going to go ahead and degrease the skin. When we do peels, I like to do the peels in quadrants. This is going to further degrease the skin. To make sure that it's clean so that the peel can penetrate. So again, we could use the clarifying toner, which has witch hazel, or we could also use the alcohol. Those are two good degreasers for the skin. I'm now going to go ahead and apply a Vaseline or petroleum jelly to the mucous membranes. You must make sure that we never get the peel in the nose, the mouth, or the eyes. So I'm going to go ahead and apply Vaseline just to the opening of the nostril area. I use the other side of the Q-tip. Then I'm going to go ahead and use another Q-tip and apply to the lip area. And then just to the corners of the eyes. And then if your client has a scab on her face, you could put some Vaseline. But scabs, if there's a lot of scabs, this would be a contraindication. We don't want any broken skin. We want an intact epidermis. Okay, so now we're going to go ahead and apply the peel. We're going to take our emerald peel. About 12 pumps is enough for the face and neck. We are including the neck. So, and then we're going to go ahead and take our emerald peel and we're going to apply the peel in quadrants. Sort of massaging it in. When the peel is on the skin, you're not going to leave the treatment room. You're going to watch for your tissue response. Your tissue response for an AHA peel is redness or erythema. When we apply the peel, We want to stay around the orbital area. We're not going to go on the eyelid itself. And I'm going to ask my client, 1 being the least, 10 being the most, what is her level of comfort? What number are you at now?
A 3.
A 3. So a 3 is fine. I'm also watching her skin. I'm watching for the tissue response. I'm using my magnifying lamp. What I'm going to do is I'm going to use cool water to neutralize the peel. And you want to leave this peel on at 3 to 5 minutes. I would start with 1 to 3 minutes for their first time when they've had this peel. So this client, this is the first time she's having this peel. So we're going to go ahead and leave it on for 3 minutes. I'm using my magnifying lamp, and I'm watching for erythema, redness, hot spots. If she feels that there's an area that is has more activity or reactivity than the other area and is not comfortable, you can always remove it. If a client gets to a 6 and is not comfortable, then I'll go ahead and remove the peel immediately. What number are you up to now?
So about 4.
About a 4, okay. So we have 1 minute left. Again, we don't leave the client with any product tint on the face. And I'm going to go ahead and get some cool water with cool compresses. And that's what we're going to use to neutralize the peel. And we're going to make sure that we keep neutralizing the peel until she's at a 0 of sensation. The other thing you can do is you can use a handheld fan, and that will help with the activity level. Fans are very helpful to make the client feel comfortable. So I'm going to go ahead and now start neutralizing the peel. We're now at our 3 minutes. And I'm just going to take cold compresses and just gently start neutralizing the peel with cool compresses. And you're going to neutralize the peel with water, with cold water. You can put ice in the water, but you never want to put ice directly on the face because that can burn the client. And so you're just going to keep neutralizing until the client's at a 0. This peel is excellent for brightening in the skin, for sensitivities, for reducing irritation, for acne. And this will make your extractions a lot easier as well. So I just keep neutralizing the peel until I'm at a 0. And I'm going to talk to my client. I'm going to say to her, do you feel activity?
A little bit.
In certain areas of the face?
The forehead.
The forehead. Mm-hmm. So she feels it on the forehead, so I'm going to keep neutralizing. A peel may take 3 minutes to do, but it can take up to 15 to 30 minutes to neutralize. I want you to be patient. I want you to continually watch the tissue response. Like I said, if you were doing a peel, we like to say 0 being the least as far as the sensation and discomfort, and 10 being the worst. If your client's at a 6, remove it immediately. Or in the area, she may have more activity in one area than the other. A lot of people also, maybe they're just nervous about peels and they have not had peels before. That's why start them with a mild peel, start them off 1 to 3 minutes and build their tolerance up. Also, using a serum at home that has an AHA in it will help prepare the skin. So she only needs to cleanse, tone, moisturize, and SPF for 72 hours. And then she can add serums in, but she does not need to exfoliate her skin for a week. And remember, I check in with the sensation and I make sure she's comfortable. And it may be that you need to continue to neutralize until she's at a 0. But remember, I like to see that the peel activity on the skin, the client is no more than a 6. If she feels that she's the comfort level is at a 6, I remove the peel immediately. If she's between a 1 and a 3, or it goes up to a 4, I give it another minute. This all depends on how many peels somebody's had, how often they've had peels, etc. So your forehead, are you at a 0 now?
Oh, yeah.
Okay. Whenever my client says they're at a 0, I then go ahead and just neutralize one more time, because the client may be just tired of having cold water on her face. So I'm going to go ahead and take a towel and blot the skin. And then we're going to move on to extractions. So the peel will make the extractions so much easier. And I'm going to go ahead and put my iPads back on my client, because I'm going to use the magnifying lamp to do my extractions. And I'm going to use the magnifying lamp. Now she doesn't have many extractions to do, but I'm going to go ahead and have a look and do it on where I can find places to extract. Definitely the nose area. You comfortable?
Mm-hmm.
When you are doing extractions on the nose, it can make the nose itchy, and it's sometimes a little painful. So I like to tell my clients, I'll check in with them, make sure they're okay and they're comfortable. And I always like to let them know that the nose can be a little bit of a discomfort. Okay, once you've done the extraction, I'm going to go ahead and tone the skin. I'm going to apply a mask that's very hydrating. I'm going to apply the marine mask. This is a gel mask. It has great anti-inflammatories in it, as well as being very hydrating. So this is an excellent mask for the client. So usually I use a mask brush, but during the COVID-19, our thought is to use everything that's disposable, and anything that you use that's reusable, you need to disinfect. And so I felt that it's not easy to disinfect the mask brush, so that's something that I won't be using right now. So we're going to go ahead and now massage the décolleté while the client has her mask on her face, her hydrating marine mask. And this is a good time that you can massage the décolleté and hands. And this is their relaxing time. So we're going to go ahead and massage the décolleté. And then while the mask is on, you can also write on the prescription of what home care I'm going to recommend for my client would be the Power Rescue and the Brighten Me. You can also write on your chart of what you saw on the skin and what you think would be great for her next time. When my client comes in again, I'm going to suggest that she adds LED. She could come and have the emerald peel twice, every 2 weeks or once a month in a series of 6. That would be very good for her. We definitely want to make sure that our client is wearing sunscreen. You can take a warm steam towel to remove the mask from the décolleté. And so you would massage the décolleté for about 5 to 10 minutes, right on your chart, right on your prescription, and then remove the massage medium. I'm going to remove the mask from the client's face, tone, moisturize, and SPF. So if I was working with acne, I would say every 2 weeks. This client particularly, once a month would be great. Adding on some red LED, I think would be an excellent choice for her. We'll go ahead and tone the skin again for her with hydration. A total everyday nutrient toner would be great. Press the toner into the skin. You can spray the toner onto the skin. You can press it into the skin, or you can use a moistened cotton round. I'm going to apply my Total Everyday Hydration, which is an excellent moisturizer for her. And I'm going to do some nice pressure point massage. I always like to say that it's results-oriented treatment within the spa environment. I'm going to make sure that she has some chem-free SPF on her skin, because we are going into the spring summer months, and we want to make sure that she's wearing SPF because she will be walking to her car. I like to use the SPF on the ears and do some reflexology, because a lot of people wear their hair up and they forget that their ears need some SPF love as well. I'm going to remind my client to drink lots of water, to keep heat off her skin, to stay out of the sun. And you would end the treatment with the scalp massage.